Hey, it's Dr. Matt Starick here from Back and Balance Clinic. Today we're going to talk about one of the biggest tendons in our body, the Achilles tendon, that can literally become a pain in your heel. We see it here quite a bit in our office from our running populations, but it is also common in other populations as well. So stay tuned as we give you the lowdown on Achilles tendinopathy. Achilles tendinopathy is a complex condition that affects both athletes and non-athletes alike by affecting their ability to engage in exercise and physical activities. It's a relatively common injury with up to 24% of athletes experiencing Achilles tendinopathy at some point in their life. It most often occurs in sports that involve a lot of running, but it can also occur in all sports and at all levels of participation. It can even be found in sedentary individuals without any sort of sporting background. Named after the Greek mythological warrior, the Achilles tendon is the strongest and largest tendon of the human body. It is formed by 3 different muscle groups in the back of the lower leg, including the gastrocs, soleus, and plantaris muscles, and attaches to the back of the heel bone or calcaneus. This allows force to be transmitted to the back of the heel, allowing for activities such as running and walking. The correct term for this condition is considered a tendinopathy. Tendonitis is no longer used as it implies active inflammation as the main cause of the condition. While there may be some inflammation present, the true condition results from a variety of factors, often precipitated by overuse and increased demand or load, i.e., too much, too soon, whereby the demands placed on the tendon exceed the capacity of the tissue. This results in inflammation and tissue injury. The changes that occur to the tendon as a result of exceeding its capacity for load result in it being less capable of sustaining a repetitive force without pain. There are 2 major groups of factors that can cause the development of Achilles tendinopathy. These factors can be intrinsic or extrinsic to the tendon. Intrinsic factors include anatomic factors such as age, for instance, older individuals, sex, males tend to get it more than females, metabolic dysfunction, muscle weakness and imbalances, and lateral instability of the ankle, amongst other factors. Extrinsic factors include things like mechanical overload, constant effort, inadequate equipment, obesity, improper footwear, insufficient warming and stretching, hard training surfaces, and direct trauma, amongst other factors. There are also 2 types of Achilles tendinopathy. Insertional, which occurs at the bony attachment of the tendon to the heel bone. This occurs more often in individuals involved in sports. Non-insertional, this is the most common type, occurring in the mid portion of the tendon. Here, nodules can be felt and the tendon might exhibit enlargement. This area has been shown to not have as much of a blood supply as other areas of the tendon, which increases risk of injury. Achilles tendinopathy is usually a clinical diagnosis resulting from pain and sometimes swelling in the Achilles tendon. This can occur at the beginning or end of exercise. Imaging sometimes shows swelling, calcifications, tendon thickening, or even tears. In spite of these tendon changes, some research shows that asymptomatic individuals also show similar changes to the Achilles tendon on imaging. In spite of this, it is paramount that we take a treat the donut and not the whole technique. This means strengthening the healthy tissues around tears or other incidental imaging findings. The management of Achilles tendinopathy typically starts with conservative management as the initial plan of attack. Depending on the symptoms and clinical picture, healing typically takes 3 to 6 months, but can take up to a year for full symptom resolution. It just depends on you as a patient. Here are some things to consider. Reduction of activity levels or modifications of activities, which we like to call active rest. We want to stay active while the tendon heals, but avoid activities that seem to flare up or irritate the tendon. Some examples would be to try biking or swimming instead of running, as well as low-impact weight training. NSAIDs can help to manage inflammation and pain. However, it is a band-aid solution as the cause for the tendinopathy will still need to be addressed. Because inflammation is not the primary cause of the condition, NSAIDs may have a short-term or no effect at all. Exercise therapy. This is where the advice has changed over the last while. For a long time, the Alfredson protocol was the go-to treatment for Achilles tendinopathy. This protocol involved predominantly a progression of eccentric exercises. Other loading programs have been developed, including the Silbernagel Combined Loading Program, which incorporates eccentric concentric exercises, eccentric exercises, and then faster loading exercises. Both of these programs, while differing slightly, have something in common: loading the tendon. Because tendons are meant to transfer load and forces from a muscle to a bone or a joint, it means that in order to treat the Achilles effectively, we need to load the tendon. You need to build capacity of the tendon to various types of loading while building over time. Some people may also benefit from strengthening the kinetic chain as well, and these may include both hamstring, quad, and hip exercises as well. Shockwave therapy. There is some research out there to show and to support shockwave therapy for Achilles tendinopathy, and this can work well with exercise therapy. Incorporating proper and deliberate warm-ups and cool-downs before activity to make sure the tendon is warm and ready and primed for movement. Proper footwear that provides adequate support and cushioning on heel strike to help take some of the stress off of the Achilles tendon. Slowly returning to sport by building up gradually will prevent overloading the tissue's capacity. This means avoiding any sudden increases in intensity or speed when playing or training. A general guideline is to not exceed a 10% increase in distance or speed in any given week. Oftentimes people with tendon injuries get into what we call a boom-bust cycle. This means that they return to sport too quickly while the tendon is still healing, and then it becomes quickly irritated again. Remember, building capacity of the tendon will take some time and should be done slowly and progressively. A mantra that I'd like is live to train another day. Pushing too much too soon is not going to be worth the increased recovery time. Be patient with the process and you can get better. Surgical interventions are available, but should only be considered as a last resort when all other treatment options have failed. In summary, Achilles tendinopathy is a common and debilitating condition that affects both athletes and non-athletes alike. The cause is multifactorial, but often is a result of sustained or repetitive mechanical loading that exceeds the capacity of the tissue. It often involves pain and swelling in the region of the Achilles tendon. Management can involve a number of different modalities, such as NSAIDs, orthotics, and shockwave therapy. However, like most tendinopathies, the most important thing that you can do is load the tendon. It is important to build up gradually over time and to not return to sport too quickly to avoid the boom-bust cycle of tendon re-irritation. Thanks for checking out our video on Achilles tendinopathy. Be sure to check out our other video on the actual rehabilitation exercises for this condition.